In this year's ESMO 2021, we heard the results of phase 2 study of combination of ipilimumab plus nivolumab plus the antagonist of IL-6. This was a phase 2 study. The results of a phase 3 study of TVEC plus pembrolizumab versus pembrolizumab plus placebo. And finally, the updated 3-year results of the combination of nivolumab plus ipilimumab in patients with brain metastases, both cohorts, patients with symptomatic and patients with non-symptomatic brain metastases. This year in ESMO, we heard the results of a phase 2 study from Jeff Weber, all from 4 American sites, the combination of ipilimumab plus nivolumab plus tocilizumab. The rationale behind this study was a way to avoid toxicity, as we know that interleukin-6 levels are related with bad prognosis in patients with melanoma and lung cancer patients. And we know that the antibody that targets interleukin-6 helps the immune-related side effects. So they designed a study, a 2-step study that tried to see if the combination of these 3 drugs would increase the efficacy of the combination and reduce the toxicity. They used a flip dose of ipilimumab and nivolumab. That means 1 milligram per kilogram ipilimumab and 3 milligrams per kilogram of nivolumab, as it was used in the one arm in the 511 study that Celeste Lebet had presented last year. And what they found is a reduction in toxicity when comparing in the similar arm, an increase in efficacy of 10%. That means 58% response rate, and grade 3 and 4 toxicity of 17%, and also discontinuation rate of 14%, that this is the discontinuation rate with single agent anti-PD-1. With these results, they are thinking of moving into a phase 3 study with the combination of these 3 drugs versus the combination of ipilimumab and nivolumab, and they might use an antibody against IL-8 that was a predictive factor of a dismal prognosis. This year's ESMO, on behalf of my co-investigators, I presented the results of Master Key 265, a multi-center, multinational, randomized phase 3 study that compared the combination of TVEC plus pembrolizumab versus pembrolizumab plus placebo. The scientific basis and rationale of this study was described and published in 2017 in Cell with first author Tony Ribas from UCLA. It was shown an increase in complete responses and overall responses, and in the serial biopsies that were obtained, an increase of the T cells were seen in the injected lesions. In this phase 3 study, 660 patients were enrolled to either the combination of TVEC and pembrolizumab or pembrolizumab and placebo. All patients had to be treatment naive and had to have injectable lesions more than 1 centimeter. The injectable TVEC or placebo was administered simultaneously with the IV every 3 weeks until the disappearance of the lesions. In this study, unfortunately, the dual primary endpoints were not met. Both PFS and OS that showed that there was a numerically difference in the two arms of 5.8 months, but this was not statistically significant. Also, overall survival endpoint was met at the second primary analysis, and with a difference of 3%, again, no difference in survival was seen. No new toxicity signals were seen, and this study is being continued in patients that have progressed in single agent anti-PD-1. Finally, in this year's ESMO, the results of the 3-year analysis from CheckMate 204, a study that was initially published in the New England Journal of Medicine in patients with brain metastases, was presented. The final results, the combination of ipilimumab and nivolumab, as it's given in patients with non-brain metastases, was given in 2 cohorts. The first cohort was patients with asymptomatic brain metastases, and the second cohort were patients with symptomatic brain metastases. In the first cohort, patients were not on steroids, and the results were over 50% response rates and duration of response that has not been reached yet after 36 months, with no new signals of toxicity. In the subgroup of patients with symptomatic brain metastases, they were occasional responses, but in general, the responses were around 20%. Following these updated results, patients with asymptomatic brain metastases may be offered the combination of nivolumab and ipilimumab as first-line treatment prior to any local treatment as stereotactic radiotherapy or whole brain radiotherapy, which is given quite rarely these days. As far as symptomatic brain metastasis patients, a combination of treatment should be decided by a multidisciplinary team.